Good afternoon. This is Morag, and this is the last webinar for the day and for the week. Wow, that's been quite a marathon for me to actually have to redo these webinars 4 times a day and one different topic for 5 days in a row. So I truly hope that people are benefiting from them, because I certainly have made a commitment on my part to do this. So we're going to talk today about what can go wrong if I don't modify my salon and spa services for people that are undergoing cancer treatment and in their recovery. The first thing I want to mention is the psychological approach of us saying no to somebody. It is in their best interest and for their safety that we say no if we don't know what we're doing. So if we don't know about cancer treatment, and side effects from treatment, we don't know how to modify it. Sometimes it is safer to say no, but it is still business. We don't want to just turn somebody away just because we don't know what's going on. So is there a way that we can very nicely suggest that they have an alternative treatment? Explain to them why. Just say, I'm a little bit concerned because of X, Y, and Z. Can we rather do this now? And let's explore this with your medical team and see if we can do this next time. You know, I hear a lot of cancer survivors tell me that they are really humiliated and embarrassed and feel awful when they're turned away from a salon or spa. So we really need to put put ourselves into their shoes sometimes, instead of just having a blatant no to them. So find a way that it's a win-win for both them and yourself. One of the modifications that needs to be made is because of somebody's discomfort. A person could have surgery, they could be going through radiation, and there could be a localized area of their body that needs adjustments for positioning and for pressure. So be aware of how you can modify their positioning. Also, with people that are undergoing chemotherapy, or they're extremely fatigued from all the treatments out there, with chemo, they can have joint muscle pain. A person with a metastatic cancer that has spread to the bone, or somebody with bone cancer, can be in extreme pain. Let's make them as comfortable as possible. I'm mentioning this company to you. It's called bellowglobal.com. The founder is Marnie Rustermeyer, and she's a breast cancer survivor and an awesome person that also does areola tattooing for breast cancer survivors. But she created these pillows, particularly the first one she created was the Bellow pillow down at the bottom on the left. And mostly it was created for breast cancer survivors. She has subsequently come out with the heart shape on the top left, and then there's also the roll. So when you've got a client coming to you, irrespective of what treatment or service they want from you, you may need to modify their position in your spa bed or table. Sometimes a person can't lie flat on their back because of back pain, knee pain, hip pain. Perhaps they have had surgery on their back. Perhaps they've had radiation to the back. Perhaps a person's had a breast removed. They can't do anything face down. So look at what modification you can do with positioning. Pressure is very subjective to everybody. I am one of those therapists that has been in the past done a lot of very hard, deep tissue massage. And so I have a tendency to use a lot of force or pressure with my hands. And it took a long time for me to be able to modify my touch into something that was a lot more gentle. And I'm not talking about tickling or feathering type of massage. I'm talking still about the flat hand, so the person feels my energy and they actually feel the full effect of my touch. I had to learn, and I was doing, when I did my oncology massage training, I was actually practicing on a cancer survivor who previously had breast cancer to the right breast, and she had reconstruction done. She had lymph nodes removed from the right side, and she had lymphedema in the right arm. or I would say the right quadrant. She also had, as a secondary cancer, developed lymphoma, and so a lot of lymph nodes in her body were swollen and full of cancer cells, and they were like little golf balls all over her. And when we were doing our practice with her, she kept saying to me, you can go harder, you can go harder. And I eventually had to say to her, well, your right upper quadrant, I can't go harder because you have lymphedema. It's not even my role as an esthetician to massage an area with lymphedema. As for the rest of your body, I'm busy skirting around these golf balls, which are the lymph nodes, and you never work and put pressure over any swollen lymph nodes or any solid tumors. So you have to modify your pressure, even for somebody who's got a liquid cancer, in other words, a lymphoma, a leukemia, or multiple myeloma. You have to learn to modify it. Now, how do you determine what your pressure is? So when we teach, we talk about 5 levels of pressure, of which with people with health challenges, we only work with the first 3 levels. Pressure level 1 is that flat hand on their skin where you're moving it slowly and you're using that effleurage motion and you are not moving any skin. Pressure level 2 is the same flat hand with an effleurage movement, moving slowly, but now starting to move skin. So you're going a step deeper. And then your pressure level 3 is actually almost like you're putting lotion on somebody, and it is a deeper one where there is movement of the skin, and you can definitely feel a deeper pressure, and they can as well. If you use a pressure, whether it's pressure level 1, 2, or 3, and you find somebody is bruising very easily, like you might see this rash here on the bottom right develop, and this is something called petechiae. Petechiae occurs with somebody, it's actually quite common with diabetics, by the way, but with somebody who's going through chemotherapy, if their platelet count is low, they have a tendency to bruise and bleed under the skin, and this is what happens. So if you find that you touch somebody and they are starting to develop these little blood clots in that on the surface of the skin, you need to stop doing what you're doing. The other image that we have here on the left, this is actually a transplant survivor, and she has been on cortisone for about 10 years. And so you can see her skin is very thin. She's very prone to skin cancers, and that happens with immune suppressed people. They're 3 times at higher risk for skin cancer. But look at the bruising. And this is very common for somebody who's on a corticosteroid. So let's work on our pressure, because what's one of the first things we can do to avoid harm. Something a little just off topic a bit here, but it's still pertinent to the cancer survivor and causing harm to them. I got some information yesterday from my sister who lives in South Africa, and she's a nurse, and there was a meeting yesterday at one of the hospitals about the coronavirus. And some of the doctors that she works with were pretty skeptical about having to wear masks out in public, even if we're just doing our necessary runs to the store and to get basic essentials. And it turns out that they confirmed this virus is not only droplet transfer, in other words, people sneezing, coughing, talking on, so the droplets will get transferred onto somebody else. But these little viruses are airborne for 8 hours. And so it is really important for us to look after ourselves, to protect others, and also to protect those that are undergoing cancer treatment currently. So what we're doing is offering up to 3 masks per person. They're made out of fabric, they're double lined. Some of them will have double fabric with a liner inside them. And there is no cost for the mask, but the cost will be for the shipping. So we're busy making masks. If anybody really needs masks, you need to email us or to send us a private message via Facebook, and we will organize to get some masks to you. The important thing with these fabric masks, whilst they're not medical mask and medical grade mask, they are acceptable due to the lack of and shortage of them. So washing instructions are extremely important. It has to be that you remove them daily, put them into the washing machine or hand wash with hot water and soap, put them into the dryer on the heat, high heat, or you iron them, because heat can destroy the virus. So it's really important that you remove it. And that's why we're saying up to 3 masks per person, because you do need to make sure you wash them every night. Now, when it comes to somebody who's actively undergoing chemotherapy right now, if they are immune suppressed, the last thing we need for them is to get this virus as well, because this now starts to affect their respiratory issues. So having breathing issues plus being immune suppressed is not a good combination. So please, out of respect to any cancer survivors, let's just, share masks. When I say share masks, order some masks for them and protect us and them. When we're actually applying products, when we're doing any kind of service or treatment on one of our clients, it is really important for us to know what side effects this person is experiencing or any kind of medical history that they've had, because what we've got on the top left here is obviously a woman who's had a mastectomy. The scar, there's 2 scars that I'm seeing there, or there's 1 scar, but it veers off into a Y. So the top part, the one that's got a black marker on, goes right up to her armpit, where you can see stitches there. So it's fairly recent surgery. Very likely she's had a lymph node dissection, which means she's had a number of nodes removed. She's also got a scar sort of heading down just to the underarm area, but in the middle of the picture there. And you can actually see an area of swelling there. I can also see a little wound or 2 down at the bottom, but the area of swelling is the biggest thing there, plus the fact that she may have had a lymph node dissection. So when we are doing a facial on somebody like her, we never direct any of our massage strokes towards this underarm area, to her right arm on the décolleté. We need to redirect over to the other underarm area, because the other underarm area, from what we can see in the picture, is absolutely fine. If we were to massage this woman's right hand and arm, we would massage up to the elbow area and then redirect the stroking to the outside of the arm, and then just feather it down or feather it up to the back towards the shoulder. Okay, so really important that these strokes are redirected, because otherwise lymphedema can occur if we're sitting there also just pushing fluid into an area where there's no sufficient nodes, because remember, our nodes are purifiers and filters. So if somebody's had a number of them taken out, she is a higher risk for getting lymphedema. And then what happens when somebody has lymphedema, it's something that they have to look after for the rest of their life. So the picture on the right here is showing you somebody with compression bandaging. With lymphedema, the person has to have manual lymphatic drainage. With a limb like the arms and the legs, because of gravity, the fluid gravitates downwards towards the fingers and to the toes, which is why the swelling seems to always start in the fingers and then the wrists, etc. up. So they have manual lymphatic drainage first, and then to support the drainage, they have to do compression bandaging. Plus, there's specialized skincare and exercises that need to be done, because the blood flow needs to continue. That area of the body still needs oxygen, but the compression from the bandages is much tighter on the fingers and the hand and the wrist than it is higher up, to keep the lymph further up instead of allowing it to drop with the gravity, if that makes sense. So we don't want to be in a situation of exacerbating a situation because of our carelessness in just doing regular massage and just massaging to an area where lymph nodes are removed and or radiated. The image on the bottom right here, this gentleman has a Port-a-cath inserted underneath the skin. And if you look at this picture, there's like a vertical line directly from that Port-a-cath up towards his clavicle. And that could be a catheter. In other words, it's a plastic tube that goes from the Port-a-cath, but it is fed into the vein. And the vein goes upwards over the clavicle, down around to the heart. And so when they give him an infusion, The middle of that little Port-a-cath has a seal in it underneath the skin. So they pierce the skin, the needle pierces through the rubber seal, and then the chemotherapy or the antibiotics or whatever it is that they're infusing goes into that rubber tube or that plastic tube, and that it goes right to the heart, where the heart pumps the medication throughout the body. So there are times when the Port-a-cath is visible, but the catheter, the tubing is not. And sometimes we can work 2 to 4 inches around it. Other times you avoid that quadrant completely. Now, if he was having a facial, when I do facials with people that are recovering from cancer or going through cancer treatment, I usually direct all my massage strokes in that following the flow of the lymph. And the lymph in the head and the neck flows down to the clavicle area. So the fact that he's got this little vein there, I would be getting to his jawline and redirecting my massage strokes down his back versus coming to the front to his clavicle area. And in his particular case there, we don't know if lymph nodes were removed from the other side, but it might be a situation where you don't touch the décolleté at all. So important to know these little things so you can modify the treatment and cause no harm. Here we have a cancer survivor who's currently undergoing treatment. She also has a Port-a-cath. You can see her clavicle, and to the right of her clavicle you can see a little scar with some bruising to the right of it. That's where her Port-a-cath is. She just recently, it was a few days before that she'd had her infusion. And then we also see discoloration to her skin, obviously inflammation. There was a dressing that was applied in the area, and then there was some surgical tape. And obviously when the dressing and the surgical tape was removed, it pulled at the skin and left some open wounds there, which are a little inflamed, but they don't look like they are too severe. So we've got to be aware that the skin is seriously compromised when somebody is going through chemotherapy and some of the other drugs. For example, dexamethasone is a corticosteroid, and it can also affect the skin. It is used as a chemo drug, but it's also used as an anti-inflammatory. So that's why sometimes it's quite useful to know what some of these drugs are and what their side effects are. From somebody who is immune suppressed and going through chemo, they can be very prone to bacterial and fungal infections, and quite commonly found in the nails. So be very careful if you're doing manicures and pedicures. Obviously, this is not a professional job that's done here, but what I wanted to indicate was paronychia, which is an infection. And this person probably would need internal antibiotics, if not topical. So be aware of these different infections that people can get when they're immune suppressed. Now here is a great example of how somebody can feel if you don't know that they're going through treatment, they don't tell you, and you do a normal treatment for them. And when I say that, I'm not just talking like a lip wax or something. I'm talking about somebody coming for a massage, or maybe they're having a facial or a manicure and pedicure, or maybe they've booked in for a facial and reflexology, you know, a bunch of treatments, and there are no modifications made. A person can have flu-like symptoms for up to 3 days afterwards, and they really don't feel well. And when this happens, this is when they kind of go, oh, I need to stop going to the spa for a while. And that's what you don't want to happen. And I'm going to give you an example of this. Just recently, I did on a cancer survivor. Let me just give you a little bit of a history. 3 years ago, she was diagnosed with sarcoma, and her sarcoma was in her lower back. So this is a tumor in the actual muscle. And attached to it was a strenoma, which is a very rare type of tumor. Apparently it was the size of a turtle, and it had wrapped itself around her spine, that she was told initially by the neurologist and surgeon that if she came out of that treatment, she would probably be paralyzed. And then it changed to, well, it might just be the right side. And she's still walking today, so she was very lucky. She had some good She had a good neurologist and she had a good surgeon to work with her. Then, I think it was a year later, she developed breast cancer. And so she had a lumpectomy. And I think that's all she had there. I have to check her history. But then, October last year, she landed up having thyroid cancer. And she had her thyroid removed. I think they started her on chemo first. I can't remember the sequence of events, but she also had RAI, which is radioactive iodine therapy. And then she also landed up having 2 sessions of external beam radiation therapy. So emotionally and mentally, she's quite exhausted, even though she has a very positive outlook on life and stuff. And I was going to do reflexology for her, even though she has completed all her cancer treatments, because she finished in January. And she said she feels nauseous a lot of the time. Not all the time, but a lot of the time. So she keeps ginger candies and anything that helps with nausea in her bag all the time, just for when she feels nauseous. So first time I saw her, I said to her, you know what, I don't think I need to do the treatment on you now, because I said, tomorrow I think you're going to feel worse. And so the second night I said, okay, because we were doing some stuff together, and I said, I'll do the reflexology for you now. And I did reflexology for her for 50 minutes. And that night she had a terrible night of sleeping. And the next day, she just did not feel well. She was nauseous. And then at one point, she was sitting here chatting to me, and she suddenly just lost all the color in her face. And she said, oh my gosh, I have to lie down. I am feeling so sick. So this is always a little lesson that we can learn, because she felt fine other than a bit of nausea. I thought, well, I don't know, because I know reflexology, and reflexology, if a person's nauseous, it can go one of 2 ways. It can make a person more nauseous because you're upsetting everything in the body, or it can help them get rid of the nausea. And I also said to her, by the way, reflexology also works with 2. Sometimes it can make you sleep very well. Other times it can keep you awake at night. And with reflexology, a person often feels worse before they feel better, depending on how sick they are. So again, another lesson learned from my perspective. So we've got to remember, sometimes the client intent and our intent is all good, but sometimes us just doing a full treatment is going to shift things in a way that makes them feel a lot worse. Why are we talking about fragrance? We're talking about doing no harm to somebody. I already mentioned to you that chemotherapy can cause people to lose their sense of smell. And what might smell very pleasant to us can smell really offensive to somebody who's going through chemo. We also have to be careful that the person doesn't have respiratory issues. For example, somebody that might have had breast cancer years ago may have had radiation which went right through the skin, any remaining breast tissue, the lungs, the ribs, the skin out of the back, and now their lung tissue is fibrotic, so they have respiratory issues now because of a history of cancer. And this is also why I mentioned the coronavirus to you right now, because if somebody's immune suppressed, they might have a smell that's affected, and apparently that's one of the symptoms of the coronavirus. But at the same time, the coronavirus is affecting people with respiratory issues or creating respiratory issues. So let's try and keep things fragrance-free as possible. So fragrance can smell bad, especially your synthetic fragrances. Fragrances can affect people's breathing, and some people are really sensitive to chemicals in fragrances. And also people can have a skin reaction to synthetic ingredients in fragrances as well. And sometimes we can control who's wearing fragrances or not, but one of our graduates right now is undergoing leukemia or treatment for leukemia, and she's finding that the medical staff actually are wearing, I don't know, their body lotion, antiperspirants, shampoo, whatever it is that they're wearing in the chemo infusion unit, and it's making her and a bunch of other patients feel quite ill. And so this is why we created these posters. The booklet is almost done. It's available for us to use in our spas, salons, hospital settings, anywhere that people are having issues with breathing, and they're having a reaction to scents or fragrance. Okay, so be aware that that is available for us as well. Canada's pretty good with this sort of stuff. A lot of the hospitals, libraries, schools, some businesses are actually fragrance-free areas, whereas United States hasn't got very many policies and procedures in place regarding this. So her request was, is there anything we can put together for me to present to the healthcare team at that cancer center so that they can actually implement some policies and procedures, again, to protect the cancer survivor. Just a few more images I want to show to you. The bottom right is a melanoma survivor who had surgery to remove the melanoma, and then she landed up having radiation to the area. And as a result of the radiation causing an infection, she was given antibiotics. And this is how she responded to the antibiotics. And it was great. It was so unfortunate. I mean, she had this all over her body. So you can see fluid-filled blisters on her. You can see how some of the blisters have already popped. And so she's got raw skin all over her body, extremely painful. So, I mean, these are things that we don't typically deal with, but these are things that can happen to our survivors that come to us as clients. So be aware of that. Bottom left, diabetic, vascular disease in the leg, and also going through cancer treatment and immune suppressed. And the skin was just thick and hard, no oxygen going to that part of the body, very prone to the leg was leaking lymph fluid, very prone to open wounds, and particularly on the back, you can see a little bit of the dressing there because of pressure sores, and it takes a long time to heal if they're diabetic as well. So these are some of the more severe things that we see. Top right is just somebody that's having a reaction to drugs, and that's the reaction to the drug. Obviously blisters there as well. And then the top left is one of our graduates who went through chemo as well, and she landed up with this particular rash from her chemo. And it wasn't just on the abdomen, it was on the inner thighs, it was behind the knees, it was just irritating, and it was sensitive. And so she needed to hydrate it and keep it as soothing as possible. Sometimes they'll just give you cortisone creams to put on topically, but you know, that also thins off the skin as well. So people that are going to cancer treatment have to do so many additional things to their skin and their bodies just as a result of the treatment. There's another condition that is pretty severe. This is a condition that will have oncologists or healthcare professionals telling their patients to avoid going to the salon or the spa. Why? It's called hand-foot syndrome. There are a couple of different names for it, medical names, but the one I use most commonly is hand-foot syndrome. The image on the top is actually an acute condition. So it starts to get red, it starts to get painful, the skin gets dry. Sometimes there's tingling, just like with the peripheral neuropathy and stuff, and it can be really painful. But the bottom right is the chronic condition, which is excruciatingly painful. People that get hand-foot syndrome in their hands and feet are unable to really use their feet and their hands, and oftentimes have to sit with their hands in iced water just to cool them down because they're so hot. Now, because they get dry, they do need to have product on them, so we've got to be really careful with this. And honestly, heat and friction are a contraindication here. So for this condition, we shouldn't be putting anything on, but if they need moisturizing, if one can find something that's cooling in like a foam and just have them pat their hands and pat it onto their feet without causing any heat and friction, that's about the best we can do with this. So just be aware that heat and friction is contraindicated, and that includes massage therapy for hand-foot syndrome. Something else that doesn't cause physical harm, it just causes an emotional exhaustion for the client, and that would be our energy, because cancer treatment as a whole, from the day of diagnosis, and sometimes when a person has gone through surgery, now they've done 8 cycles of chemo, now they've got to do 36 sessions of radiation, they're exhausted. We've got to watch our energy around these people. You know what? We've got to slow things down. And some of us are just very gregarious and bubbly, and we want to talk, and, you know, and get as much information out as we can. But it doesn't help the person that is extremely fatigued and exhausted from their diagnosis. So just focus on really trying to chill out a bit when you're working with them, but still give them the benefit, which is mindfulness. Every webinar, we've been talking about one service. I am concluding my webinar today with corrective makeup. Why do I love this? It's a simple little compressor, this Airbrush machine. I'm not partial to any brand because they're all the same. And I use these for minor imperfections. Somebody that needs help with their appearance. What I love about it is there's very little risk for bacterial and fungal infections and microbial infections and stuff, because we're not using sponges and brushes. The Airbrush gun is metal, it can be sterilized, and it is so quick to do. This is a cancer survivor in Brazil, and she just finished her 5th cycle of chemo, so she had very little hair. But I did her makeup for her, and I did the scarf. We did scarf wrapping techniques as well, but 6 to 8 drops of 2 different colors to blend her skin, to get her skin the right color. I used a different shade for her blusher, and then I took stencils and found a brown color that matched, I guess, her skin tone and stuff like that, and did her brows. I thought the brows were a little too dark. She just loved it. And I'm telling you, she did. She ran around quite delighted with the outcome. So, you know what? It doesn't cost you much, because you're using such a little bit of product, and even the investment in the machine, I think it's about $200 or $300 US, whatever. It's a fantastic way to end off a treatment with somebody if they're looking, you know, pale because they're anemic, or, you know, ashy, green, gray because of chemo, maybe areas of radiated skin, maybe scars from their surgery. You can use the Airbrush machine to cover all those things and make somebody feel really good about themselves. Ladies, we've come to the end. Thank you so much for joining us today. If you have any specific questions, just email us on info@oti-oncologytraining.com. If anybody's looking for masks, please send us an email or private message us on Facebook. Have a great day.